Hi, I'm Dr. Clint Witsman, and today we're going to go over some strengthening exercises for your shoulder, whether you're post-surgery or you're just got some stiffness and some weakness in there or some pain. These will help you hopefully decrease those symptoms and increase your function. Alright guys, this is the first strengthening exercise we're going to start. We're going to work on our shoulder blade here, getting it nice and strong. You're going to lay on your belly on the edge of your bed, edge of your couch, or if you happen to have a table that can hold you, you can do that as well. Alright? You're going to hang with your involved shoulder off the edge. Just let that arm dangle, okay? Then all you're going to do is you're going to squeeze your shoulder blade across and down towards your opposite hip. Okay, so let's go ahead and do this here, Marcia. Squeeze up. Perfect, just like that. Do you see how that shoulder blade moved? And then she's going to go back down. Good, and keep going here for me, Marissa. Good. See how that shoulder blade's moving? I'm going to show you with my hand here. Go ahead and squeeze up and across. So it's coming at an angle down towards the opposite side. So we're using these muscles right here. She's not using this muscle up here. That's important. Make sure you're not pulling that shoulder blade up towards your ear. She's going to do this 30 times, once a day. And, with anything else, if she can't do 30 right away, she's going to start with 10, 15, whatever that is, and work her way up to 30 eventually. Alright, so the next one we're going to do, she's going to lay on her belly again. She's going to lay with that involved shoulder off the edge of the table. You can do this on your bed, on your couch, or on a table if you have one like this to support you. Okay? All she's going to do is she's going to squeeze that shoulder blade up and across towards that opposite hip. Go ahead, Marissa. Good. Alright, we're going to relax. I'm going to show you that one more time. She's going to squeeze up and across towards that opposite hip. Good. She's going to hold that contraction. With her elbow straight, she's going to lift out to the side as she's holding that contraction in her shoulder blade and back down. Good. Keep going there for me, Marissa. Good. Now, you can see Marissa here is a little weak, so she's starting to cheat a little bit and her shoulder blade's going up. That's normal, okay? When that starts to happen, what you're going to do is you're going to stop, go ahead and relax, and you're going to re-get this contraction. So lift up, hold, and then keep going out to the side, all right? She's going to do this 30 times once a day. And, just as Marissa's not strong enough to do 30 yet, you'll start with 10, 15, and work your way up to 30. Alright, so you're going to need to be laying on your belly for this, so do it on the edge of your couch, edge of your bed. If you happen to have a table like this, that will work as well. You're going to lay with your involved shoulder off the edge, okay? All you're going to do is you're going to start out by squeezing that shoulder blade up and across. Good, just like that. And relax, Marissa, I'm going to show you that one more time. Let's squeeze up and across. Good, just like that. You're going to hold that contraction. With that elbow straight, she's going to lift her hand up here towards her hip. Good, and back down. Good, and keep going for me there, Marissa. Okay. She's going to do this once a day, 30 times. Starting out, you might not be able to get 30, so start with 10, 15, whatever that is, and then work your way up to 30. The next one we're going to do here, you just need to be able to lay on your bed or on your couch on your side, okay? This is Marissa's involved shoulder, so it's on the top, okay? All Marissa's going to do, she's going to bend her elbow up, and she's going to start with her hand down here, all right? She's going to keep the elbow here at all times. All she's going to do is she's going to lift up and then back down. Good. Go ahead and do that a couple times there, Marissa. She's going to do this 30 times once a day. Starting out, if you can't get 30 right away, start with 10, start with 15, and work your way up. The important part is to make sure your elbow stays at your side. Alright guys, next you're going to lay down here on your back just like Marissa is. You can do it on your bed, on your couch, wherever you're comfortable doing it. Okay, she's going to raise her arm up so that her hand's in line with her shoulder. Okay, all she's going to do is she's going to punch to the ceiling, keeping her elbow straight. Good, just like that, and back down. Keep going there for us, Marissa. See how that shoulder blade rolls out here to the side, the elbow staying straight. Okay, she's going to do this 30 times once a day. If she can't do 30 right away, she'll start with 10, 15, whatever that number is for you, and you'll work your way up to 30. Next one we're going to do is you're going to need a chair to sit in and either your kitchen table, kitchen counter. If you happen to have a table like this would work. This might be a little bit too high, but you want it right in this area right here in your mid-abdominal area to height. All Marissa's going to do is she's going to put the elbow up here on the edge of the table just in front of her chest and out to the side. Her hand's going to be facing down. Now for this one, you either need a TheraBand or you can use a can of soup, or if you have a little hand weight, that would work as well. The TheraBand you can get from your therapist if you have one. If not, like I said, use a lightweight or a can of soup, okay? All she's going to do is she's going to step on this right here with her foot to anchor it to the ground. And then this is going to come up and she's going to grab the band. Once again, palm is down, all right? If you're using a weight or something, you don't have to anchor it to the ground. Just make sure your palm's facing down when you're grabbing. All she's going to do is keeping her elbow here, she's going to lift up. Yep, just like that at that angle and back down. Good. Keep going for me here, Marissa. She's going to do this 30 times, once a day. Now, starting out, you may not be able to start with 30, but start with 10, start with 15, work your way up to 30. You get a TheraBand from your therapist, okay? They can tie a knot in it, you can tie a knot in it, but you need to make sure you have something tied in it, because what we're going to do is we're going to open the door, and we're going to put the knot on the other side of the door. Then we're going to shut the door. Make sure the door is nice and latched. Pull on the band a couple times to make sure nothing's going to come loose. Okay? Then I'm going to have Marissa step over here. Alright, the first one Marissa's going to do, she's going to keep her elbow right here at her side. She's going to grab the TheraBand. Make sure she's got some tension on it. Okay? She's going to keep her elbow right here, and all she's going to do is straighten her elbow. Good, making this muscle contract. Good, keep going there for us, Marissa. She's going to do this 30 times, once a day. And if she can't start with 30, then we'll start with 10 or 15, and she'll gradually work her way up to 30 as we go. You need to anchor a piece of TheraBand at the top of the door, just like I showed you earlier. Okay? Marissa's going to grab it with her hand. She's going to step back and straighten her elbow. Good, just like that. Okay? All she's going to do is she's going to pull down to her hip. Just like that. Keeping her elbow straight. That's the important part. Lock that elbow out. Good. Keep going. Can you get any further there for us, Marissa? All the way down there. Good. Just like that, okay? She's going to do this 30 times, once a day. And just as the other ones, if you can't start with 30, start with 10 or 15 and work your way up. This one, you're going to need to anchor that TheraBand in the door again. All Marissa's going to do is she's going to grab the TheraBand, make sure there's some tension on it, okay? Then all she's going to do is she's going to pull back like that, squeezing her shoulder blade across her body. And then keep coming forward. Good. Keep going there for Marissa. See how she's squeezing that shoulder blade across that body, just like that. Good. She's going to do this 30 times, once a day. If she can't start with 30, she'll start with 10 or 15 and work her way up as she goes. Alright, so you're going to need to anchor that TheraBand above the door again. Make sure the door is latched so it doesn't come open on you. Marissa's going to stand with her involved shoulder towards the door. She's going to grab the band and she's going to step away from it. So her elbow's nice and straight. What she's going to do, she's going to pull that band down to her side. Just like that. Good. And she's going to slowly take it back up. She's in control the whole time. Alright? She's going to do this 30 times, once a day. If she can't do 30, she'll start with 10 or 15 and work her way up. You're going to need that TheraBand with the knot tied in it again. Okay? You're going to open the door. If you have a loop tied into it, that's great. If not, just make sure your loop's on the other side of the door. Or the knot. You're going to make sure it's not in the way of the latch. If it's in the way of the latch, the door could come flying open and slap you in the head. So make sure that's out of the way. Shut the door. Test your band out to make sure the door's not going to open on you. Alright, and you're set. First thing Marissa's going to do, she's going to step over here and face the door. Just like that. She's going to grab the band in her hand so there's tension on the band. Okay? All she's going to do is she's going to pull back, squeezing her shoulder blade across her body, and then she's going forward. Keep going there for us, Marissa. Good. You can see how that shoulder blade comes across. She's squeezing really hard right here. And that's perfect. She's going to do it 30 times once a day. As with the rest, if she can't start with 30, she'll start with 10, 15, and work her way up. Alright, so once again, you're going to need to anchor that TheraBand in the door, right by the door handle. Okay? Marissa's going to stand with her involved shoulder away from the door. Okay? She's going to grab the band. Make sure there's tension on the band. She's going to keep her elbow in at her side the whole time. All she's going to do is rotate her arm out, good, and control it on the way back in. She's going to do this 30 times once a day. If she can't start with 30, then she'll start with 10 or 15 and work her way up. Once again, the important part is that elbow stays at your side. Alright, once again, you need to anchor that TheraBand in the door at about doorknob height, okay? Marissa's going to step forward here. She's going to stand with her involved shoulder towards the door. Okay, so this is the one we're working on. She's going to grab the band with that hand. She's going to keep her elbow in at her side. She's going to start with a little bit of rotation out to the side like that. Okay. All she's going to do is pull across her body. Good. That elbow needs to stay at her side the whole time. Okay, that's the important part. She's going to do this 30 times, once a day. If she can't do 30 right away, she'll start with 10, 15, and gradually work her way up. For the next one, you're going to need a little hand weight or a can of soup, can of beans, whatever you have, something that just adds a little weight. Maybe starting out, try it without any weight in your hand at all, and then add the weight as you go, okay? But for Marissa, I'm going to give her the weight. She's going to keep her elbow straight, and her thumb's going to be facing up. All she's going to do is lift her arm up to shoulder level and back down, okay? She's going to do this 30 times, once a day, and if she can't get 30 right away, she'll do 10, 15, and work her way up. All right. Now, as Marissa gets stronger, what she's going to do is she's going to lift all the way up over her head, just like that, and then back down. She's in nice control when she's doing it. Good. So this is something that you would do after we get some good strength built up in there. Then you'd add this on. So another one we're going to do, you'll need a lightweight, can of soup, can of beans, whatever you have at the house, just add a little weight to your hand. I'm going to give this to Marissa. She's going to start with it right here. Okay? All she's going to do is she's going to push straight up into the air, straightening her elbow, and come back down. Good, just like that. She's going to do this 30 times, once a day. If she can't get 30 on her first try, then she'll start with 10, 15, and work her way up.